Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Today, we're continuing our conversation on how to support patients with HR-positive, HER2-negative breast cancer receiving CDK4/6 inhibitors through team-based strategies. This highly individualized treatment requires care coordination to deliver high-quality care.
I think the biggest thing that is specific to CDK4/6 inhibitors is because it gets so complex in terms of those eligibility criteria and when we're using the drugs in what setting, that having those monitoring protocols and getting that multidisciplinary collaboration is really key.
That's our guest, Julia Ziegengeist, joining us from the Atrium Health Levine Cancer Institute, where they've integrated CDK4/6 inhibitors into clinical practice using standardized protocols.
Well, of course, we've had these on the market for a good bit, but our indications have expanded over time. So initially, when adopting these, of course, it was a lot of looking into what are the side effects that we need to be looking out for, and how do we make this manageable for the clinic team. So a lot of that focused around, for example, creating a form where providers and nurses can see what specific labs need to be monitored and why. So, for example, ribociclib does require EKGs, and how frequently do we need to get those? So, kind of adopting some of those basic things were one of the first steps. Since then, with the expanded indications, we're also utilizing things like our internal pathways that allow providers to know when and how to incorporate the drugs into a patient-specific treatment. So expanding out to those. And of course, now that we have patients who are regularly starting these, figuring out how our education visits should be structured and when we're going to see those patients back. So those were kind of some of the initial steps where we needed to tease out and work on those specific things.
When I sat down with Julia, I asked her to walk through what the patient's journey looks like.
So they encounter a lot of different teammates throughout that process. So of course it starts with the initial consultation with the provider and discussing why that specific agent is needed, and the patient agreeing to kind of move forward with that treatment. From that point on, our prescription gets sent to our specialty pharmacy for benefits investigation. And we have a fantastic specialty pharmacy team that will help us with copay assistance, with processing prior authorizations. So they're kind of one of the first steps, and the patient is obviously going to have contact with either them or maybe an outside specialty pharmacy to discuss those things as well. The patient comes in for a education session, which can be either led by myself as a pharmacist in the clinic or by one of our APP providers, so a nurse practitioner or a PA. And we're discussing all of the basic things, such as like dosing, administration, adverse effects, and going into all of those details further. Other people that the patient could come into contact with throughout the care process, obviously the clinic nurse. So we always advise our patients, when you know that you're going to receive the drug, please let us know. That way we can document your start date. We also provide calendars for the patient that specifically go over what date to start, when your last day is, and when your off week is, if that's applicable to the patient. So they're discussing with the nurse, and the nurse is letting everybody else on the care team know that the patient specifically started on this day. Other folks that the patient is going to come into contact with could also include like our nurse navigators. So they help with getting patients connected with financial counseling, insurance, also things like transportation services. We have financial navigators, and then also a social worker within the clinic too that can kind of help them with some of those more like holistic approaches.
Patient education is a big focus for us here. So I asked what the Atrium Health team does when they come across barriers with those patients they work with.
And this is something that comes up frequently. So you really have to assess each and every patient for not only what their health literacy is, but also what kind of support they have at home. All of those things are going to play into it. And oftentimes their initial interactions with the provider are going to give you some insight there, but you can also kind of switch gears as you're doing the education session if you notice that something's just not clicking. So a couple of things that we do, obviously, for our more obvious things, like a patient who is not English as their first language, we can provide education packets. So there is a oral chemotherapy education handout that was created jointly by ACC, HOPA, and CODA, ONS. That is very great, and we frequently use those handouts to go over the chemotherapy. And there's also some for example, OncoLink has one, has education handouts that also are in different languages. You can try to use Google Translate, all of the things to get you to a place where you can meet the patient in a way that they can understand. And of course, when it comes to health literacy, we have patients that maybe even have like low reading literacy, and obviously that comes with its own challenge too. So an example that I'd given previously is patients who there was specifically one patient that was not English speaking, and then also they had low health literacy. That was not obvious at first. So she was counseled with a Spanish speaking interpreter and a Spanish language handout, a Spanish language calendar. But it became very clear after a while that there was a disconnect and that the drug was not being taken how we expected it to. And it turned out that she eventually shared that she had low reading literacy as well, even in Spanish. So some things that we utilize there, filling the pill box for the patient. That's a great thing to do, and can kind of allow them to use that pill organizer without having to necessarily read, a full calendar. You can use kind of like a pictorial calendar to help you with that. So really just kind of assessing those things for the patient and then engaging their caregivers too, because oftentimes they'll share a lot with us about patients' habits at home, or can be somebody who can serve as a reminder or an advocate for the patient, somebody who can even call us to let us know that a patient's having a side effect. So I think this is absolutely critical when you're incorporating these drugs into practice.
Thank you, Julia. You can click the links in the show notes for more on managing CDK4/6 inhibitors for patients with HR-positive, HER2-negative breast cancer. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.